my name is Nurse Sherry. Today we're going to be going over the CNA testable skill, cleans a urinary catheter. There's a few things you want to know about a urinary catheter that are important and will help you with your written exam. The first thing is that the urinary bag should always stay at the level. This is your urinary bag. It wants to stay at the level or below the patient at all times. You don't want any fluid that's in the bag to back up and go back into the patient's bladder. That could cause a UTI. The next thing is you want to make sure that this is always on the bed frame. You don't want it on any part of the bed that is moving, like when the patient moves the head up and down. We want to make sure it's on the frame and not anything else. And the third thing that you need to know is that they should always have a holder for the catheter. As you can see, she has a holder that is a Velcro one. This will keep the catheter in place so that there's no tugging. There's different kinds, and I've even seen people use transparent tape. All right, so then for our skill, the first thing we're going to do is knock on the door. I'm going to wash my hands. I'm going to provide privacy. I'm going to check the bed to make sure that it's in a locked position. I want to make sure that my patient has his call light, which he does in his hand. And then I'm going to introduce myself. Hi, my name is Sherry. I'll be your CNA today. The next thing I want to do is identify my patient. We usually use two identifiers. If you're in a hospital, they'll have a wristband. And if you're in a resident home, a nursing home, it'll be in the chart and they'll have a picture of the patient. So you'll say, can you tell me your name and date of birth? He does. And then I'm going to explain the procedure. Mr. Smith, I'd like to perform catheter care today. Would that be okay with you? I'm asking consent because anytime we do any procedure on a patient, we want to make sure that we get consent. All right, patient says it's okay. All right, I'm going to gather my supplies and I'll be right back. So I'm going to go out of the room. I'm going to wash my hands, knock on the door, provide my privacy. And now I have my supplies. For cleaning a urinary catheter, you will need 1 pair of gloves, 3 washcloths, 1 for washing, 1 for rinsing, and 1 for drying. And then you'll need a peri pad or a Chuck's pad, which is more of like a paper pad, and a water basin and soap so that we can clean the area. The first thing we're going to do next is go ahead and put the pad underneath the patient. So I'm going to go ahead and apply my gloves. Then you can ask your patient, Ms. Smith, are you able to roll on your side? If she is, then she will go ahead and roll. And if she's not, then I'm going to go ahead and show you by removing the blanket so I can show you how I would roll my patient. And I would go ahead and cross their legs. I'm going to grab at their shoulder and at their hip. I am going to roll them to their side. Then I'm going to grab my pad. I'm going to open the pad up. I'm going to make sure that it is above the buttocks and covering underneath the peri area. If you roll it, it'll make it easy to go ahead and get it from the other side. Then I'm going to expose him just to show you. I'm going to tuck it underneath of the patient. That way I don't have to spend a lot of time going around the bed. Then I'm going to roll the patient back over. I'm going to roll her my way and get the rest of the pad out from underneath the patient. Make sure that the call light's in. All right, and now I have my pad underneath my patient, and it's covering everything. So now I'm going to cover the patient back up because the patient should be covered during the procedure, but I just wanted to show you how I would roll the patient. Next thing you're going to do is go ahead and bring your blanket down. You do not want to go past the knees. I always go a little bit above the knees. I don't need to go that far for this procedure. So we're only exposing the area that we're working on. Then I'm going to lift up the gown to expose the area of the catheter. I know that I have to wash at least 4 inches, right? Okay, that's going to be important. Next thing I'm going to do is get my water. You want to make sure that your water is warm, and bath water, ding, 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 another question for your written exam, would be at 105 degrees. So I'm going to ask the patient if he would like to touch the water and make sure that it is at comfortable level. It is. After we get the water and the patient has tested it and said that it is comfortable, I'm going to take my first washcloth and I'm going to put it in the water. I'm going to rinse it out to make sure that all the water is out of it. I am going to take my 4 leaves and I'm going to apply soap to each leaf. So a little dab of soap on 3 corners. Then I'm going to make sure that I pinch the catheter at the meatus. The purpose of this is to make sure that you are not tugging on the catheter. It is very painful for your patient. So I'm going to take my first corner and I'm going to clean 4 inches down. I'm going to pull this back, grab my second leaf, go 4 inches down. Remember, this has soap on it, so I'm washing. Pinch at the meatus on the catheter, go 4 inches down. This is dirty, so this is why I have a barrier here, so I'm going to place it on my barrier. My next towel, I'm going to put in and get water on it, and this is for rinsing. Again, I'm going to make sure that I get all the water out as much as possible, and I have my 4 leaves. I'm going to pinch the catheter again and wash down. I'm rinsing the soap that I had off. Now I go to my second leaf, 4 inches down. Go to my third leaf, 4 inches down. Now this is dirty, so I'm placing it on top of that one. My last one is going to be a dry towel because I need to dry the area. So then I'm going to take my first corner, dry 4 inches down. I'm going to turn my leaf, pinch at the meatus, go 4 inches down. One more, pinch at the meatus of the catheter, and go 4 inches down. I am all done with that portion of it. All right, Miss Smith, I am all done. I am going to go ahead and roll you over and take the pad out. Again, I'm just going to show you. I would have the patient covered at this time, but I want you to be able to see. So if I had him here, I'm going to have him, of course, this bag. If I was going to change it, I could go over here and then place it on the frame of the bed. But you need to make sure that it's on the frame of the bed, okay? All right, so I'm going to cross his legs, grab at his shoulder and her hip, roll her up. I'm going to roll the pad in, just the one that I was using. Remember, this one was already here. I'm going to tuck, again, just like I did before. I'm going to roll the patient back over, and I'm going to roll this way, just barely, to go ahead and get the pad out. I'll make sure that I put the call light back in the patient's hand while it's here. Okay. And then now I can put this on my towel as well. That's all my dirty stuff. I'm going to put his blanket back on where it was. I'm going to check the bed to make sure that it is locked and at a safe level for the patient, and it's in the lowest position. I'm going to ask Miss Smith if she needs anything or if there's anything I can get her. If she says no, then I'm going to go ahead and take my pan. I'm going to empty it. I'm going to run some water in it, rinse it out, and dump it in this back in the dirty area. I'm going to take my linen that was used, and I'm going to place it in the dirty linen utility area, which usually you'll just have a little rug. I'm going to put my supplies back. I'm going to remove my gloves the proper way by pinching the inside of one hand, put my fingers in the other. There, going to go in the trash can. I'm going to wash my hands, and I'm going to stay skill complete. As always, thank you for watching. Please